Welcome back for e-learning program of today's session from Department of Prosthodontics. The topic is very tiny and small. It is more concerned about the preclinical aspect of the prosthodontics, that is festooning or wax up procedure of complete denture processes. This particular laboratory technique is performed once we finish the maxillary and mandibular anterior and posterior teeth setting, and the remaining portion between the teeth and denture base is built with wax and carved into a certain configuration to mimic the alveolar process and the gingiva. As per definition, festooning is defined as a process of carving the denture base to simulate the contour of natural tissues. That includes the alveolar process and the gingiva, which are being replaced by a artificial denture. This topic can be discussed under two different aspects. The first one is the clinical aspect. In that, we will be discussing this topic under different headings. That includes when to do this festooning procedure, what is the right time to do it, then where or which locations to do these festooning procedures, and the last one is why or what is the necessity or the significance of performing this festooning procedure. Later classes, the preclinical aspect of or the technical aspect of the festooning will be discussed. Before I start explaining about the clinical aspect, let me revise one small content of this particular topic which is related to this particular topic, that is surfaces of a complete denture. The surfaces of complete denture can be categorized under three different aspects. The first one is the tissue surface, or also called as intaglio surface, which is recorded with the help of the master impressions or the final impressions. Second one is the occlusal surface, that includes the incising units and occluding units. And third one is the polished surface or the artistic surface. This polished surface is the location where we supposed to perform the festooning procedure to mimic the last structures. The right time to perform this wax-up procedure is immediately after completion of the posterior setting as well as the establishment of the occlusion. This particular laboratory or the preclinical work should be or must be completed before we proceed with the clinical wax training procedure. And the other aspect is which locations are where we do this wax-up procedure. So in this aspect, four important locations are considered. That is labial, buccal, lingual sulcus area, which clearly reflects in the diagram A. The second one is labial, buccal, lingual, gingival flange contours. The third location is palatal area if it is a maxillary denture. And the last one is the denture base, which is located distal to the last molar. The first diagram in the bottom clearly demonstrates the proper extension of the wax-up into the sulcus. The wax should occupy full depth as well as width in this particular location. With this, the proper establishment of the peripheral seal and aesthetics will be achieved. The second diagram demonstrates the extension of the gingival flanges, the contour of the gingival flanges. So here, the muscles will coordinate with the denture contours to create an aesthetic and natural position. So the gingival contour is performed in such a way that it will follow or it will synchronize with the muscular fiber pattern of the lip and cheek regions. Third diagram demonstrates the palatal portion of the maxillary denture. It is divided into two parts, anterior half and posterior half. Anterior half influence in the phonetics. That's why when we do the wax-up procedures, we intentionally create the rugae pattern in the polished surface of the maxillary denture for better phonetics. The posterior half of the palatal area helps to establish the peripheral seal in the form of posterior palatal seal. And the last diagram demonstrates the denture base extension in the distal to the which is located distal to the last molar, which we have arranged. So the proper contouring at this location allows the tongue to brace the lower denture and helps to establish the stability. The last and most important theoretical aspect of this discussion is to know about the significance or the importance of properly contoured dentures. Properly contoured dentures always improvises the stability. With that, the comfort zone of the patient always in a positive way. The control over the dentures, especially the lower denture, and the tolerance of the denture will be improvised. Proper phonetics and aesthetics are re-established with a sufficient support of the lip and cheek. The different photographs projected in this slide clearly demonstrates how the musculatures are related with the complete denture. The first photograph demonstrates the relation of extraoral musculature from the labial aspect and from the buccal aspect to the external surface of the maxillary and mandibular dentures. Whereas the second photograph shows the location and position of the tongue in the intraoral segment and how it is related with the lower and upper denture. Always the lateral part of the tongue relates with the lingual flanges of the lower denture and the dorsum of the tongue relates with the palatal aspect of the maxillary denture. So the dentures are contoured in such a way that these internal and external musculature need to be accommodated properly to improvise the stability. When it comes to the stability aspect, always the lower denture stability is compromised because it is surrounded in 360 degrees with a different musculature. From the labial side, the mentalis muscle, orbicularis oris muscle, from the inner side mylohyoid muscle and the pterygomandibular raphe, the buccinator muscle from the buccal side. All these muscles influence or compromises the stability aspect of the lower denture. That's why the contouring with the proper wax-up procedure is a must and need to be implemented. The fourth photograph in this slide demonstrates how the forces are generated from the outer and inner musculature and its influence on the complete denture stability. There are two different types of forces generated when the dentures are in the function intraorally. The first one is the vertical forces, which are favorable in terms of stability as well as it is very well tolerated by the patient or the basal tissue. The second category of forces are called as non-vertical forces, are also called as horizontal force or the oblique forces or the lateral forces, which are very damaging to the basal tissues as well as compromises the stability of the denture. Lastly, the fifth and sixth photograph in this slide gives clear visualization how the external musculature is relating with the external surface of the denture and how the internal musculature is relating with the internal surface of the complete denture. So, considering all these aspects, the labial, buccal and lingual flanges are contoured in such a way that the muscles are comfortably accommodated in the contoured structure of the dentures. Either over contouring or the under contouring will compromise the stability aspect of the denture. It may affect the phonetics, definitely it will affect the aesthetic aspect of the patient as well as it may cause the lip or cheek biting. Hope you all understood the significance of the proper festooning or the wax up of complete dentures with this short clinical discussion. The next session will be on the laboratory aspect and we will be discussing about the various techniques and the method of doing proper wax up technique. Thank you very much.